Good evening, everyone. Thanks for joining us this evening. And you've come to the discussion portion of this very special event called Caring for Caregivers that's brought to you by Austin PBS, AARP, and St. David's Foundation. I'm Andrew Levack, and I'm a Senior Program Officer with St. David's Foundation, where I oversee our Aging in Place portfolio. And it's really a pleasure to have you here today. I've been enjoying looking at the OV platform and hearing very thoughtful and sweet comments from many of you who've been watching the film, and really appreciate you spending some of your personal time to join us today. We're going to have a panel discussion with three amazing panelists who have a lot of background and focus on these issues, family caregiving and end-of-life issues. And so what we'll do is I'll take some time to introduce them. We'll share some comments. We have some of your reflections that you shared when you registered for this event, so we'll ask them some of those questions. And then there are going to be opportunities for you to share additional questions to these great panelists on the OV platform, so feel free to pop those in at any time. And just also a reminder that if you've registered for this event, we'll be sharing an email out to you tomorrow that'll provide a lot of information about resources around caregiving and end of life and advanced care planning. So please keep a lookout for that. But without further ado, I'd love to introduce three amazing panelists who are really here to talk about the film and issues that have come up with the film and to share their reflections and answer questions that you may have. So first, I'd love to introduce Dr. Jessica Zitter, the director of Caregiver, A Love Story. We're very honored to have her here today, and thank you, Jessica, for an amazing film. Jessica is a strong advocate for a new approach to caring for the dying. She specializes in critical care and palliative care medicine and practices at a public hospital in Northern California. Dr. Zitter's first book, Extreme Measures, Finding a Better Path to the End of Life, offers an insider's view of intensive care in America and its impact on how we die. Her work is featured in the 2017 Oscar and Emmy nominated short documentary Extremis, which you can find on Netflix today. Thank you, Dr. Zitter. Secondly, I want to introduce Josephine Kalipeni. Josephine is the Executive Director for Family Values at Work. Born in Malawi, Josephine has seen inequities in one of the poorest countries in the world and one of the richest. Having worked as a social worker, she has seen firsthand the systemic challenges families experience. She has since worked in policy advocacy, organizing, campaign and strategy development, and strategic planning for 2 decades, centering on those most marginalized. Thank you, Josie, for being with us today. And last but not least, we have my colleague, Amanda Fredriksen, who's the Associate State Director of Advocacy and Outreach at AARP in Texas. Amanda leads AARP's state regulatory and legislative work in Texas on caregiving and long-term care. Prior to joining the state AARP office in Texas, Amanda worked for the Texas Health and Human Services Commission, where she was responsible for oversight and coordination of long-term care policy and special projects. So as you can see, we have an amazing panel of fascinating folks who bring a lot of experience and perspective around these issues. And so what I'd like to do is first start off with Dr. Zitter, our director, and really just talk about the film for a moment. And it gets me every time. I've watched this film many times, and it's such a powerful reminder of the journey of end-of-life care and of the burdens of caregivers. And what I wanted to ask first is just a very generic question for you to share the story about what inspired you to make this film.
Well, thank you so much again for having me, and I'm so glad to be with these distinguished panelists. Thank you for having me. This might surprise you, but I did not set out to make this film. I set out to make a different film. I really thought I was telling the story of an amazing and courageous woman who you saw on the film, this amazing woman who really chose to die well. I thought, oh, this woman is dying well. She's making the right choices. She's doing things that most people don't have a chance to do. And so she happened to be a friend of mine and part of my congregation. And she was I helped her get into hospice. And then once she was in and her life started to get so much better so quickly, we decided to make a film about how it can look to have a beautiful death at home. So, as you can see, and as we can all see now, that is not what this film showed. And what I realized in looking at the footage a year after Bambi had died was that the film I had thought I was going to make, where Rick was a secondary character just opening the door for hospice, was not the right film. The film had to be about Rick because his trajectory and his arc was so shocking and so important to study and put forth to the rest of us in this country and abroad. So it really wasn't my intention to make this film, and I have learned so much that Josie and Amanda already probably have known for years and years and years. This is something that I am coming to much more recently by complete chance. And by the way, I'm a palliative care doctor, so that is saying something really alarming about the fact that even I, who think about patient-centeredness and care about the end-of-life experience, missed this public health crisis.
Oh, thank you for Jessica. Thank you for that, Jessica. And that's such a powerful metaphor, because I think about, for so many caregivers, and I actually heard this in some of the reflections in the OV chat, that as they went into their caregiving journey, they could not have imagined what they were going to experience. And so in some ways, you set out to make a film and you weren't prepared to see what you're going to experience in documenting this. And I think that's a very personal experience for a lot of family givers too, caregivers too. I want to ask you one more question about the film, which is that now that it's been wrapped up and in production and in distribution, what would you, I mean, everyone gets to take whatever they want to take away from the story, but what do you take away from it? And what would you like people to take away from this very powerful story?
What I want people to take away from this, you don't necessarily get all of this from just watching the story of this one family, but what I really want people to understand is the context and the extent of this crisis. It is it is huge. 1 out of 5 Americans, 53 million Americans, are family caregivers. And that's rising. It's rising significantly all the time. And we saw with COVID what's shocking, how any of us could be a caregiver. I hope that it opened the American imagination to realize, oh my gosh, that could be me. So the crisis is huge. The crisis is rising. Our demographic shifts in this country are shocking. The American family is changing and shrinking and spreading out, and more people are living into old age. So this changing ratio and demographic is going to be something that we are going to have to contend with. And the second piece I want people to understand is that this is an invisible crisis. If I didn't know about it, believe me, lots of other doctors, lots of other hospice workers, lots of other people who work in social services, lots of other employers do not have any clue about this until they get there themselves. And so we have to raise the consciousness of this country and the awareness around this issue fast. And that's the third part. We've got to act now. This is not sustainable. We have watched COVID ravage a huge proportion of our caregivers and increase the pool of that and shrink our paid caregiving workforce, which most people can't afford anyways. And we have to act. This is an active conversation that's happening in Congress right now, today. And we should all be thinking on a local and personal and family level about what we can do for caregivers, and on a more of a state and federal level as well about what we need to do. So those would be my messages.
Oh, thank you, Jessica. You know, these platforms don't give you the ability to have a collective amen, but I saw the heads shaking in the room, and I know that it would be the same in the OV platform. So thank you. Josephine, I want you to build on that, and I want to sort of think about the fact that Rick's story is so powerful and at times overwhelming to witness. And at the same time, we can recognize that Rick had a lot of resources that many caregivers don't have access to. And so I'd like us to move beyond Rick's particular story and hear your reflections on what the landscape of family caregiving looks like across the country. And what else should we consider, and what else do we need to understand about this issue?
Well, first, Andrew, thank you so much for having me. It is one of my favorite things and heartbreaking things to talk about all at the same time. And I'm hoping that everyone gets a chance to watch this beautiful film that, again, gives you hope, breaks your heart, and, sort of illuminates just so much. I think there's a lot that we have to consider that is both within Rick's story and outside of Rick's story. I love the fact that the film highlights a male caregiver, right? Actually, a lot of our experiences are that a majority of caregiving is done by women. Both the paid caregiving and the unpaid caregiving is often done by women. There's a lot that I can say in this moment. I think it's important for us to ground in the reality that a lot of how our caregiving infrastructure is set up is a set of historical policy decisions that are meant to really uplift capitalism before uplifting the needs of everyday families. And to Jessica's point, it is an invisible crisis until it's your personal crisis. And all of a sudden, it's a crash course in both all of the things that you thought would be in place that just aren't, and all of the things that you need to be doing. And the reality is, because of modern technology, because of medicine, because of, nutritious food, the reality is either we'll need care or we will have already been a caregiver or we are soon to be a caregiver. That is just the reality that we are all living in. Rick is fortunate in that he had savings to spend down. But even then you hear him say, I spent down the savings, right? So even any cushion that you think you have depletes quickly. So then imagine the majority of caregivers who are majority women who are dealing with socioeconomic factors, including chronically low wages, right? Women technically almost always make less than men, which means less savings, which means less into retirement. So we put that on top of all the other factors that we're talking about. And I think it's a critical thing to consider. The other thing that I just want to name is that will always be complicated. It will always be diverse. And while I do believe that we absolutely have to build the policy and programmatic infrastructure that also means paying workers well, we're not getting rid of family caregivers. So we absolutely have to build the infrastructure of support for family caregivers that honors both the obligation, the responsibility, the hard and loving work of doing caregiving, and all the other needs that we know have to be in place just to make it work. And the last thing I'll say, I can say lots and lots about this, is that one of the things that I thought was really interesting and a little bit silent in the story, but is actually the experiences of about half of the caregivers in this country, is that Rick was a sandwich generation caregiver. He was caring for his spouse and caring for a young child. We know many grandparents who are raising grandchildren, but we also know many working adults who are caring for an adult with a disability that's a family member, as well as caring for a child or caring for an in-law while caring for a sick spouse. And so there are demands that are coming for caregivers from both ends when you're talking about a sandwich generation caregiver. We're talking about people who are spending $7,000 out of pocket a year, who think Medicaid and Medicare is going to step in and sort of do these glorious things that you find out in a crisis moment just do not exist. And until we're really talking about both visibilizing and valuing care and caregiving, we're going to continue to burn out workers who are caregivers, and we're going to continue to burn out caregivers in ways that has generational impacts on economic wealth, on well-being, and on mental health as well. So lots to say about the landscape that we need to understand, though I feel like this audience is probably made up of mostly caregivers who understand both, the incredible, amazing, beautiful moments and all of the complications that also come with it.
Thank you, Josephine. Yes, I think we are primarily preaching to the converted here, but we can still preach, and you get an amen as well on that for sure. I appreciate that. And thank you for highlighting that piece about Rick being a sandwich generation there. And I mean, it kind of floored me, right? When all of a sudden we realized that Rick is also providing care for a young grandchild. And it is such a norm that it only felt appropriate that would be the profile. So powerful. Amanda, I want to turn to you, and I want us to, we shared a little bit about the state of unpaid family caregiving in the US, but I'd love for you to reflect at AARP in Texas, some state data, and then both at the state level and on a national level, would love to hear kind of some reflections on what we can do within systems to address these challenges that caregivers face.
Sure. Thank you so much, Andrew, and thank you to St. David's for this event. I think it's really terrific, and Dr. Zitter's film is just really fantastic. I think you've kind of nailed it. You know, even though there are things we can say that Rick is not typical of a caregiver, it's hard to say what a typical caregiver is. You know, so many people are going through this journey. Here, you know, in Texas, we're looking at about 3.4 million Texans on any given day that are unpaid family caregivers. And, you know, we talk about it a lot as like family doing what family does for each other, you know, and a lot of this is about helping loved ones stay at home, age in place, die at home. And, you know, that was a big deal before COVID, but I think COVID has only made that that issue and the desire to be at home that much more important. AARP has been tracking for a long time unpaid family caregiving, and really trying to put a value on that, because we recognize that this care is it is really priceless, but it is important as we try and tell the story of family caregivers and really try and give them voice to understand that we actually have more unpaid family caregivers than we do paid caregivers. That, you know, if we as a society had to replace the care that they provided, it would be far more than our current Medicaid budget. It's, you know, just for Texas alone, we're looking at billion with the B, you know, at $12 an hour. You know, that's not a lot of money. And I think it kind of, you know, sort of fits what this workforce, what the paid workforce often faces. In terms of kind of what we're doing with this, I want to say too that I loved that Jessica referred to them as this is an invisible crisis, because at AARP we often talk about family caregivers as a silent army. And we see our role as really trying to support that silent army by really making sure that they're heard in the halls of Congress, in the Texas legislature, and that they have, you know, the supports that we can provide as an association through materials and information and that sort of thing. In terms of kind of federal and state kind of government supports, there's been some little progress. You know, it's little, but it's progress. You know, in 2018, Congress passed something called the Raise Family Caregiver Act, and it basically sets the first sort of stepping stones towards a federal sort of roadmap and strategic plan to support family caregivers. That group has met over the last 2 years, and just not last month, but in September of 2021, they released their first report with a series of recommendations. So a baby step, but certainly Congress and others are paying attention. You know, in the Budget Reconciliation Act that's on the table right now in Congress, the House Ways and Means Committee actually included a recommendation to establish a tax credit for unpaid family caregivers to help with those costs that Josie was talking about, that average of about $7,200 a year. Tax credit wouldn't cover all that, but it would help to offset some of those costs. In Texas, we've been working to make sure that caregivers get the information they need when they're discharged from the hospital. Important because they're being asked to do more and more when they take home a caregiver, take home a care recipient, changing wound dressings, managing complex medications, all kinds of stuff that us as lay people we're not trained to do. So making sure they have that information. And then the last piece is we have a little bit of funding in Texas for something called respite care to make sure caregivers get a break. It's $1 million every 2 years. With 3.4 million caregivers, anybody I think could do the math and sort of go like, we could probably do better. And we think there's a really wonderful story to tell in terms of, investing in unpaid family caregivers and making sure they have the resources and the break that they need so that they can keep going on, because that's far better than trying to find $35 billion to replace them when they get worn out. I'm sorry, that was a lot, but
that was a lot. It was great. No, you get an amen as well. And it's really important to highlight all those pieces. And you echoed some things that Jessica and Josie talked about in terms of reconciliation. Josie, I know you're really kind of on the ground in DC monitoring things. Any reflections from you about the current policy environment and advancing it?
Yeah, there is a lot that is in the Build Back Better proposal that, devil's in the details, and who knows what happens in the 59th minute of the 11th hour, right? As was mentioned, there are some good things in there about support, some of the tax credits to support caregiving. There's also a humongous boost to home and community-based services that we haven't seen in decades. Is it enough? No. Is it a substantial signal to actually the infrastructure that we need to build? Yes. And we've seen it from the pandemic that our infrastructure was not ready to handle people staying at home or people needing to be released from institutional settings to go back in home and community-based services. And those investments in home and community-based services is going both to programs, which are the needs of people who need care, but also going to build the workforce to make sure that they are paid well, that they are trained well, and that they have the benefits they need is huge. And then there's other threats, right? The reality is that dropping paid family and medical leave, the threat of dropping paid family and medical leave in the Build Back Better proposal is just, it's a gut punch to family caregivers who know that the reality of even making care work means having to work, right? So you can't miss a day on the job. At the same time, you have to show up for the people that have long cared for you. And we can't do that without paid family and medical leave. We can't all hope to win the good boss lottery or the good state lottery. Oh, Texas. So we need a federal program, right, that builds a foundation that starts to establish equitable benefits that specifically target working caregivers. There's no other way for people to make ends meet on a regular basis but to work. And then there's actually the option to say, can you imagine Rick's option if they had to say, it's either a roof over your head with your paycheck or taking care of Bambi? And that's an impossible choice for anyone. And dropping paid family and medical leave makes that the continued reality of many, many caregivers. So we have to set a foundation and we have to do better. And I want to also decentralize the idea that power sits in DC. States have lots of power and maneuverability. Locales have lots of power and maneuverability. We have done polls over and over and over at the city level, at the state level, and you would be surprised what people are willing to pay to ensure that they can receive care in their homes, that they can care for someone else who might need them to step into that role. So, the idea that we can't do this, the reality is that we can't afford not to do something about this fast-moving train that many of us have already been impacted by, and many more of us will be impacted by.
Thank you.
Can I say amen?
Please.
I just read, and I can't even remember where I read it, that 90%, over 90% of civilians, of people, not just caregivers, but people living in communities, support the idea of supporting family caregivers. So there's a lot of broad support across political lines here for supporting caregivers, and it's just not happening yet the way it needs to.
And the piece around paid family leave is so important. And it was interesting to hear Rick stepping away from his job, right? And so many people don't have that choice, but he was able to do that. But it reminded me of one of the statistics I saw, which said that of those 48 million unpaid family caregivers, 61% of them are currently working, right? And so just to think about that, right? The majority of unpaid family caregivers are currently working and trying to figure out a way to do the absolute impossible. Absolutely.
Yeah, and I'll just add to that, Andrew, that we've heard the stories of people who are turning down raises, turning down promotions, cutting back hours, moving to different industries of work because of the flexibility. And our economy loses billions because of the lack of support for family caregivers. That's huge for us to think about.
I was going to add on to what Josie was saying. Exactly the issue there, all that economic benefit, but also the long-term implications for people who step away from work. What does that do to their long-term financial security, to their retirement? And what does that mean about how well they're situated when they are in the same situation that the person they're caring for? And there are all these long-term consequences for not helping caregivers to be able to keep their jobs and to continue to keep their loved ones at home and safe.
Absolutely, it is a vicious cycle in that regard.
And I was just going to say, we look to government as one place for support, but there are 60% of family caregivers are employed. And what about employers? They're losing. I saw, and you correct me if this is no longer the correct number, but $65 billion that employers and are losing from caregiver turnover, having to leave their jobs, healthcare costs of caregivers because they're getting sick at much higher rates because of their caregiving responsibilities and stress. So, so if employers also have a stake in this game, and the question is, what are they going to do? And some employers are coming in and really starting to try to bring in more benefits. Some of the more progressive employers are doing that. But what's interesting is that I saw again another statistic that shows that more than 90% of caregivers surveyed who working caregivers do not feel safe or supported by their place of work, even when there are benefits available. They don't feel that the culture is one where they can go in and say, I'm a caregiver and I need support. And that really needs to come from higher up. You can put in fancy support for caregivers, but if it's not getting used, how helpful is it?
Absolutely. It's interesting when we talk, we'll kind of move between sort of the big systemic policy pieces and the very personal. And a lot of the questions that we had from the individuals when they registered were personal, but they all kind of lead to those intersections. So the first one touches on both. It was around, and I think it's really first for Dr. Zitter, because it's a question about probably maybe your initial intentions of the movie. The question is, do you see a movement towards embracing death and dying in American culture?
What a complicated question. I come to this work, I'm an ICU doctor, and I work in the four walls of the hospital. I work in the four walls of the ICU. It's a very, very rarefied place, and it's not going well. The way we care for patients at the end of life in intensive care units is not the way it needs to be. We're doing things sort of what I call the end of life conveyor belt without a lot of, planning and thinking and communication and compassion. And so what's happening in the intensive care unit really needs improvement. And I think there's been a big grassroots movement since the beginning of the palliative care movement, and even before that, to try to get people more informed and making more plans. Unfortunately, I hate to say this, but the data isn't great about the advanced care planning movement. It hasn't really worked.
Yeah.
And so, we're still having all sorts of very, very, very high technology, high intervention, non-beneficial treatments for patients at the end of life in this country, even with this movement. And so I think we've still got to really look at why that's happening and what is wrong with the patient, family and physician communication piece here, because it's not working. And then, this whole outside of the hospital environment, which, as you can see, I'm new to, because I had my head in the hospital. The fact that I had my head so in the hospital, the fact that most American physicians have no idea what's going on outside in the community, that we don't know what Josie and Amanda know, and is really a problem, because a hospital is a magnet for caregivers. So for things that require supporting a caregiver, which is all of the stuff that happens outside of a hospital with serious illness, we are really not doing a very good job of identifying these caregivers and supporting them. So I think there's a lot of intention and death positivity. People are talking about the death positive movement. But unfortunately, I don't feel that the gears are clicking the way they need to. And there's a lot of work that needs to be done that isn't really uh, something that lay people who aren't really involved in this can know how to do. And so I feel that the responsibility falls with us in healthcare, us in social services, public health, and we've got to just do a better job at helping people achieve the better deaths that they are craving, because what's happening now, more and more consumers are realizing is not what they want, and we really aren't providing, I think, in the right way, a really good path towards achieving what people really say they want. I didn't mean to have such a negative or down.
No, it's a reality, and it's coming from a foundation where we're trying to increase people and having more advanced care directives. We're as we explore that space, we're realizing that that's not the silver bullet that we thought it might be, because it's only the systems are, if the systems aren't there to support that, it isn't necessarily as impactful as we would hope. What were you going to say?
Well, I just want to say one thing, and I don't want to take too much time, but I don't want people to walk away thinking that advanced directives aren't good, because there is a very important piece of an advanced directive, which is figuring out who your surrogate is. Everyone should figure out who their surrogates are. That's an incredibly important thing and very productive and really makes a big difference. So we don't want to throw away the advanced directive, but the concept of this advanced care planning and just having a conversation about end of life and it's going to result in good outcomes, that's not translating.
Right. Well, and I would say we still need to think about what is the death that we want to have, right? And we want to convey those pieces, right? But we want to have more systems that support it than just, one advocate to sort of help, guide that through. Absolutely.
Well, if I could chime in for a second, I think, this isn't going to happen overnight. It's not going to be if we could get everybody to do their advanced directives, check, we're good. Some of this is really deep cultural challenges, and probably you need an anthropologist or a sociologist or someone on here to it'd be an interesting conversation, a whole different conversation. But I do think the more we talk about caregiving, and the more we talk about and make the conversation more open about some of the stuff that's not so easy and not so pretty, and that is a little bit hard about caring and dying, I think it may help to change and move the conversation so that it becomes more commonplace and something where people are more willing to share. But we've got a really long way to go.
Is it all right if I take one more second to say something? Which is, I think that is actually brilliant and true, because there are many kinds of advanced care planning, right? There's this advanced care planning that we all think about, which is, do you or do you not want to be on a breathing machine? Do you or do you not want to have chemotherapy? But then there's the advanced care planning that Caregiver, a Love Story, points us towards, which is the advanced care planning around being at home and mustering your, what I call homegrown help, in the absence of state and federal support that we're all asking for, but it is not there. And so what kind of advanced care planning can an individual caregiver or family do? And I think it is better to back into the conversations about what you want in your life through the caregiving lens than it is through the do you want a ventilator lens, because that stuff doesn't work. We know it doesn't work yet. But it can work, and it is less threatening to talk about how do we organize our household so someone can take care of mom and one person's not going to become the sacrificial lamb. So I agree with you.
Oh my gosh, I can totally endorse that. I've talked about, it's the caregiving planning is where you start, right? And that's like a frame to build in the other conversations as well. So another piece that was highlighted in the film, Rick actually has a quote where he talks about the fact that he hasn't been trained to do this. And so one of the questions pre-movie was rather predictive of what they were about to see. The question came from one of the registrants that said, when a patient goes into hospice care, a caregiver is thrust into a role for which they have no training. Do you see that changing? So I'd like y'all to reflect on that. Amanda reflected on the CARES Act, which is starting to address that, but it's not enough. So we'd love to hear any thoughts about that.
Amanda, you're on mute.
There we go. Thank you. Thank you, Josie. I could start by just saying on the CARE Act, the idea is that when someone's discharged from a hospital, there's a lot more to do than there used to be. And family members are not prepared to do that. And I think the situation with hospice is sort of, turned up to 11 in terms of what folks are asked to do, and quite frankly, the limited help that's available to them to navigate that. And I don't know that that's going to change right away, but I sure think we all need to be pushing for it to change, because it's not going to create the system that it hasn't created the system people want, and if we don't do something different, it's not going to give us the system that any one of us would want for ourselves or our loved ones.
Yeah, and I'll add to that I think the CARES Act is such a great start, and the intention behind it really starts to get us at what caregivers need as far as training and support in that way. But we also can think about other creative ways to support caregivers, because when I think about the crisis moments that I've been pulled into caregiving, as much as I'm like, I need to know all of the things, the other thing I can't do is stop for 3 hours to sit in an intensive training. And so there are, we just have to really think about creative ways that meet caregivers where they are, and oftentimes when they're already there. And so, we've thought a lot about what does it look like to have advanced roles for home care workers and for hospice aides as featured in the film, where part of their pay and part of their work is to actually come into the home and do some in-place training, because it's a different thing when you're actually training someone in a hospital and then they have to go home and replicate the same set of trainings there. So, we can think about advanced roles for home care workers and for hospice aides, right? In almost any other situation of crisis, when we think about youth in crisis, which was my entry into advocacy, youth in crisis get a caseworker who helps provide wraparound services, not just for the youth, but for the family and everyone that's around them. And sometimes the simple act of a doctor asking, do you have a caregiver, do you have a community, do you have a care squad that's going to support you in some of this, and having that be the starting place. Because oftentimes YouTube University is not the best place in information overload. And the last thing you want to Google is, what do caregivers need to know? Because I've written a lot of those pieces, and the first 10 probably don't even get you where you want to go. And then what does it look like to have peer-to-peer supports that are supported in community and that also provide people a level of income? And then the last thing I'll just add is, the disabilities community has been brilliant at really thinking about what home and community-based services and supports need to look like, and what formal and informal care supports look like. We have seen pilots in Pennsylvania and in Maine where people who need care are actually the ones training the caregivers, right? Because they have an intricate, intimate, and expertise knowledge in a very, very different way. Again, what often happens is we have these conversations about the needs, then the scale of the needs starts to come into play, and all of a sudden you have a set of the choir that's singing the tone that we can't afford to do, actually to offer these supports, and we can't afford to do them in a way that's quality and supported. And the reality is we can, right? There's many different ways that we can. And lastly, I'll just say, we can't forget to actually ask caregivers. No one is an expert at caregiving more than an actual caregiver, especially folks who are in that window of being past their caregiving demands. Like the reflection and insights and expertise that they offer in that moment. So if we're not talking to the people directly and most impacted, we're missing a set of wisdom and expertise that only can be captured by tapping into who they are.
Wow, that's cool. I like all of those ideas. And I will just say that because of this film, have come into contact now with so many caregivers who have now passed, including Rick, by the way, have passed their caregiving time and are at odds and have been really traumatized by the experience to the point that they say, and I've heard this so many times, I want to give back. I want to help somebody else. I want to tell them what I learned. And I really think that idea of harnessing those people's passion and trauma, it could be a therapeutic experience for them to do a peer-to-peer training. But I will say from the medical perspective, I really believe in using film all this lecturing and PowerPoints and doesn't work. So what works, I think, showing people stories. And that's why I make these films that are really bringing you right into the bedside, right up to inside the house. And so we've brought this film in to teach medical students and piloted it a couple of times. And it has been shocking to me to watch these young medical students and medical residents watch the film, the lights come up, and they're like, oh my goodness. And they're all telling me about cases that they had just over the past week. I was just focusing on the patient. I didn't even think about her. Now I'm remembering what that poor caregiver looked like. And I think we have this concept in this phrase in medicine, see one, do one, teach one. If you can just show people what it looks like with some real person's story, it can really start to change hearts and minds. And then obviously you want to give them strategies for, well, what can you do in your clinic? What can you do if you're sending someone home with hospice? And you can give people some practical tips. It could really make a big difference. So I like all of these stories, but I think we've got to start using some more dramatic, different kinds of approaches to trying to teach about this stuff.
If I could just mention one more thing, something Josie said triggered something for me, and it was your observation about the disability community, and you are spot on. They have been so effective in shaping and telling the story of home and community-based services, and they've been particularly successful in Texas. And Texas has actually gone, much farther than a lot of other states in terms of really trying to, when it comes to Medicaid dollars, help people get care at home and stay at home as long as possible. One of the things that AARP tracks across the states is something called nurse delegation. And there are about 16 different tasks that a nurse can delegate to someone they train, often a family caregiver. And states control under the nursing license how many of those tasks can be delegated. I think in Texas, they are allowed to delegate something like 14 of the 16, one of the broadest states. And that can go a long way to providing that bedside training and assistance, because not only is the nurse required by he or she is licensed to train on that task, but their license is on the line. And so they are, going to be paying more attention if they're a good nurse, going back and checking and making sure that that task is done correctly. So to the extent that caregivers in Texas feel like they're being asked to perform nursing tasks, they should be asking for that training. And the home health or hospice folks they're working with should want them to have it, because it's going to protect everybody and it's going to do the best possible for the care recipient.
Amanda, I'm so glad you raised that point, and I wanted to echo it as well, in that it's really been our disability community in Texas that has really championed consumer-directed services, which is the ability to have Medicaid reimbursed family members or whoever that individual identifies as a caregiver to provide in-home care and have it reimbursed. So I think part of what's happening in this movement that Josie's a part of around the care economy is people understanding that, oh my gosh, we're all caregivers. We're caregivers for people living with disabilities, for older adults, for young children, working families. Oftentimes, as Jessica's story shows, it's more than one of those constituencies, and that the real power in the movement is talking about caregiving across those generations. So we're going to move. We're kind of at the point we've been talking about, using the questions that have come before the film. We do have an OB platform, so I'm going to invite Laura to come in and see if people have been talking in our absence about us, and see if they have any questions for us. So I'll invite Laura to share anything that she's heard on the chat.
I'm trying to get my video on, but I am here. Hi, I'm Laura with Austin PBS. We're so happy to be a partner in this film and important conversation. We have been watching the chat today, and it's just been incredible conversation happening. There's been so much support for the caregiver community happening. I will say that there hasn't been as many questions because there's just been so much support, and you can just see it's really needed, and this is a vital conversation to be had. But we did see a great group of questions that came earlier before, and we do have some other ones as well. So I just wanted to start us off with one from our registrations. How do you care for an elderly parent without having it hurt your own physical and mental health? And this was actually coming up a little bit in the chat as well. So we'd love to hear your response to that one.
I'm happy to start us off. I think the first thing is, as hard as this is to try not to not lose yourself and your health and sacrifice. You know, we all want to throw everything into it. This is someone we love. We want them to have the experience in crisis or in dying, and it's easy, I think, for people to put their health aside. You know, we certainly saw that in the film with Rick having a sort of a 5-day situation where he was out of pocket and not available for Bambi. That happens all the time. And so often we probably all know stories of, you know, a couple and the wife was caring for the husband, and all of a sudden the husband's still alive and the wife drops dead from a heart attack or untreated cancer or whatever. You know, this is really common, and it's so important that people that the caregivers take the time for themselves. You know, whether it's a doctor's appointment, going to get your hair cut, having a cup of coffee with a friend, all those things are so important in kind of making sure that you don't totally for yourself. So I think that's really important. And I think really reaching out, trying to connect, you know, there's so many ways to connect with people online. And I know when we do caregiver events, whether they're virtual or back when we did them in person, you know, it's caregivers feel really isolated and often like they're going through this by themselves. Especially if there's not family support. And so I think finding ways to connect with others who are having a similar experience is really important to help to deal with that kind of giving you some perspective in the sense of isolation and loneliness.
Yeah,
Amanda, go ahead, Josie.
No.
Oh, well, I'll share something, and Josie, please jump in after me. But that piece around caregiver support reminded me of a really powerful story I had. Age of Central Texas was one of our grant partners, and they have 2 adult day health centers. And I remember early in my tenure at the foundation, I went to visit their adult day health center in Round Rock. And when I went out there was a crowd of sort of middle-aged adults out front talking to each other. And I came in and I talked to their director. And at some point I asked Laura, I said, who are those people standing out there? She's like, oh, those are caregivers. And like, they come early on before it's time to pick up their beloveds, and they hang out, they talk to each other, you know? And so it's just, you know, to your point, Amanda, right? It's like, that is so needed. And I even saw that just in the chat, right? Before we even started the movie, I felt this sense of solidarity, right? With so many people who have caregiving journeys and caregiving stories, and just to kind of be able to share that experience, right? Just to tell someone about what you've been through, I think is so powerful. So.
Yeah, and I just wanted to add to that, you know, there's both the like no silver bullet sort of, you know, response that I think about, and the finding the small and big moments to try to preserve some physical and emotional and mental health. You know, I often think about one of our caregivers who told us that one of the best things she did was constantly pass on knowledge and sort of the things she was learning to 2 or 3 other people that were in close relationship with this care pair. That way, you know, she could leave for an hour, knowing that someone, you know, who was there could also, you know, respond if anything was to happen in that hour. I remember another caregiver saying they would literally just hide in the bathroom for 10 minutes of quiet, right? And it is both, you know, it is both the like, the reality is the respite infrastructure in our country for caregivers is not adequate. It's not well funded for states. $1 million in Texas to 3+ million caregivers is not sufficient. So finding those ways and finding your local, you know, some of the local programs actually will help with mental health services, will help with physical and emotional well-being. The challenge, you know, without having well-funded respite is finding the time to then tap into those practices, which is why oftentimes the care squad is really important. The other thing that I'll just say, which becomes part of our cultural posture towards care, caregiving, and caregivers, is even in the toughest of moments, we're still so apprehensive about having some very hard conversations. A lot of that is because of what we know about, you know, relationships, whether it's like parent-child relationships. We know that it's hard in the process of losing independence, right? Like what that feels like on both angles. And yet, you know, these moments where there's so much relief out of having transparent conversations, we still sort of like shy away from those because caregiving is front and center, or because the relationship is complicated, or because of these feelings of like, this is my obligation, this is something I just have to do, so I better, you know, grit and bear it in all of its silence and it's all of its sort of oppressive moments, when actually the beauty of films like this and the beauty of having transparent moments is being able to have those transparent conversations that actually take a lot of the pressure out of the pressure cooker of what caregiving situations are. So I have heard so many caregivers say, I said this one thing and it sort of burst open the floodgates of this conversation. And all of a sudden there was so much more relief between this caregiving relationship that I also just encourage people to get to really lean in a little bit more into those really hard conversations that allow a little bit of emotional pressure, because that's the other thing. We don't quantify and we don't name the emotional labor, and the emotional labor is as you know, heavy as the actual day-to-day demands of physical caregiving. And so we have to deal with that. There isn't a magic bullet, but there's just these, you know, little things and sometimes big things that we can do. And damn it, Demand Texas provide all family caregivers, you know, some compensation, some free mental health services, some free supports. You know, like this silent army needs to show up in ways that are organized and as powerful as the labor of caregiving that we give.
And the rest of us who are not yet caregivers need to show up for them, because, you know, we're the ones who, I mean, we need to sort of see this as our future as well and get invested and support them. But I want to say, you know, as a doctor, there is data that shows that caregivers, I mean, have profoundly worse just blood levels of inflammatory markers and lipids and inflammation. I mean, this is impacting people's health in significant ways. And, you know, emotionally, it's impacting people's health. I mean, there was in August, early on in the few months into the pandemic, there was the Morbidity and Mortality Weekly Review came out and showed some alarming numbers about caregivers compared to non-caregivers and what was going on for them in those early months of the pandemic. They were 5 times more likely to use drugs and alcohol to cope with their stress than non-caregivers. They were 1 in 3 caregivers. This is unbelievable to me. 1 in 3 caregivers in the August Morbidity and Mortality Report had reported seriously considering suicide. That's 10 times the rate of the non-caregiving population. That is just beyond comprehension to me. So I think that if we can look at caregivers as a group of very, very medically and emotionally vulnerable people, and if they can look at themselves that way, then maybe we can move into a place where more of us are moving in to help them, and more of them are moving out to ask for help. And earlier on, before things get so oppressive that they can't even see their way out.
I just want to say I really appreciate you bringing up that point, Jessica. It's I feel like we've talked more about kind of maybe the medical side of caregiving, but there's a huge population out there that's caring for folks with Alzheimer's or some other form of dementia. And a lot of that is not medical, it's emotional and behavioral. And finding the supports to manage those kinds of care needs and understand how to respond when you have outbursts that reflect a personality of someone that you don't know anymore, because of their disease. Those kinds of things are so challenging, and it's a whole different set of supports that population needs that's caring for folks who have Alzheimer's or some other form of dementia. And I think making sure that folks understand that there are resources out there, maybe not enough, but looking for folks like the Alzheimer's Association and others that can provide support groups and that sort of piece, I think is really important, because I think knowing folks that have been through that experience, it can be so isolating, and can be a very long, difficult journey for the caregiver. And so making sure that those folks know it's okay to ask for help, and that people need to do it. I will say too, one of the things that I think has been, if there's such a thing as a gift in a pandemic, it would be the increased access to telemedicine and telehealth, which I think something AARP has been a big advocate for, but we're really pleased to kind of see how it's evolving and really fighting to keep it to be on par in the Medicare world with in-person, because we think it's really valuable for the care recipient and the caregiver. Sometimes it's a real pain to load somebody who's frail and complicated into a car to a doctor's appointment, to expose them during flu season and a pandemic. And if you can take care of it over the computer, that's great. And telemedicine can also be a really good way to get some mental health support for caregivers. And so really encouraging folks to do that. So if there's a bright spot in COVID, maybe telehealth and telemedicine is a bright spot.
Older adults and rural areas too, where access is even more difficult. Absolutely. We have only about 7 minutes left. I'll ask Laura if you've got one burning question coming out on the chat.
Well, a theme that kept coming up was transition, and one question that kind of rose to the top was, what is the biggest needs of family caregivers as they transition out of the family caregiver role following the death of the care recipient?
I can speak to what happened with Rick. I think that Josie and Amanda can speak more broadly and generally, because you have more experience with caregivers than I do. But Rick, as he says in the film, it took him 1.5 years to get his bearings. He was so shaken up by this. He really had trouble going back to work. He was running on fumes, and after Bambi died. So I think that's really an important thing. And I'd love to hear from Josie and Amanda about that question.
So, I would say what we see and hear from our members and from caregivers when we do caregiver events is everybody's different. We've had people show up at caregiver events who were caregivers and kind of didn't know what else to do. So they saw that other caregivers were getting together, and even though the person they were caring for had passed, they came to the caregiver event because they were kind of lost and were having a hard time finding people who could understand what they'd been through. And so I think, and then there are other people who I think just, process the experience very differently and kind of pick up and move on. But I think it's really personalized and really different for different people. And I think probably a lot of that is probably what you've had to give up during the time as a caregiver, how long your journey has been, what you've sacrificed, and how well you've kind of managed that, and whether or not you've had support from others and kind of kept a network. I think a lot of that really makes a big difference for folks.
Yeah, I will just add that I think, two things. It is a transition into a new normal, right? What family caregivers sort of jump right into this role and do it quickly. And it's, it becomes all encompassing that once that's not there anymore, it is about finding a new normal in the ways that all of us can sort of, understand in situations where we've been faced with having to find a new normal, how challenging that can be. So I think it's worth sort of naming that and noting that. I also want to say that it's grief. And it's grief in different ways. It's loss, right? Whether it's because the person you are caring for has passed away, or whether it's because that demand isn't there anymore, and now there's this sort of gap in demand and time. So we have to name it loss in order to really recognize the emotional, mental, and physical impacts that has. And I think it's important to be able to provide family caregivers with mental health supports and communal supports, right? Because as Amanda said, being able to plug back into a community that understands these experiences becomes a critical point of post-caregiving support. And also the mental health of dealing with the sense of loss and needing to find and navigate a new normal. And oftentimes also needing to navigate new financial demands and new financial realities and new relationship realities, right? Being able to really support family caregivers, and that becomes incredibly, incredibly important. The last thing I'll just say is that the other thing we hear a lot in a very practical way is that a lot of family caregivers have been out of the workforce for a long time because of the demands of caregiving. And all of a sudden people need reskilling and upskilling and to update skills that, they haven't used for years, and to re-enter the workforce, and just really need those sort of practical supports and being able to get back into the workforce in real meaningful ways.
Thanks, Josie. So we're at time. So I want to oh my gosh, this panel is amazing. I want to thank each of you so much for your contributions. My phone has been blowing up from my colleagues saying, this panel is amazing. Oh my goodness, I'm so impressed. So trying to ignore it and just pay attention to y'all, but it is exciting. And we, on behalf of the foundation, we truly, truly appreciate it and our partnership with Austin PBS and with AARP. I should make a note that we will be sharing, for anyone who is registered, as I mentioned, we'll be sharing a resource tomorrow via email that will come from the foundation that will share a lot of resources that Jessica, Josie, and Amanda have put together for y'all. So keep an eye out for that, and please stay in touch. And a final word of thanks to all the caregivers who are out there who joined us today. We see you and we thank you. Thanks, everyone. Have a great night.
Thanks. Have a good night.
Thank you. Have a good one.